Welcome back to America's Retirement Headquarters, home of the Retirement Guys formula and America's Medicare Associates with Nolan Baker and Scott Kirshner. 419-794-3030 is the phone number. It's 419-794-3030, online at americasretirementheadquarters.com. In the first half of the show, we were talking, and Scott, you mentioned very briefly the annual election period. Mm-hmm. Scott, I know right now is one of the busiest times of the year with open enrollment. So can you tell us a little bit more about what Medicare changes are coming and what you see in the trends with health coverage this year?
Absolutely, Chris. Yeah, it's a busy time. I'm loving it. This is where, I've got back-to-back appointments from 9 o'clock to 6 o'clock, but it's fun. I love it. It's the annual enrollment period. A lot of changes have been put in place for 2023, and it's important if you don't have an advisor that's reached out to you or received a letter from your current advisor to go through and look at your current plan and talk to you a little bit about what's changing in 2023. You need to. That's a service that we offer here at AMA, and it's a free service. There's no sit-down charge, or we don't charge anything for going through your review and making sure that the plan that you currently have is working best for you moving into 2023. But some of the key points, we talked a little bit about Social Security, and there's an increase of your Social Security check if you are getting Social Security of $5.20. I know, don't get too excited. It's a whole tank or gallon of gas. So the Medicare Part B premium is going down from the standard from $170.10 to $164.90. So anybody that is currently enrolled in Medicare right now, you're paying a premium for Part B that is dropping in 2023. Some other key points that are dropping: anybody that is on insulin is being capped at $35 copay per month. That's a big one.
Yeah.
That helps a lot of people out. When COVID hit, the COVID shot was covered under the Medicare Part B. Wasn't covered under the prescription Part D, but it was covered under Part B. So what they've done is they've come along and said, well, we're going to remove cost sharing for the shingle shot. Fortunately, I haven't had to deal with a shingle shot yet. I do remember both my parents had the shingles and the shingle shot. So the shingle shot is actually quite costly. That is actually going to be covered at no cost sharing moving into 2023. So that's also another good thing that's happening. And the Medicare Part B deductible, in 2022 it was $233. That is the out-of-pocket expense if you have a supplemental plan for your Part B. That is going down to $226. So some good things that have happened in lowering some cost for the seniors is Medicare standard premium going down and your deductible going down, and some capping the insulin at this point. So, there's a few good things that are happening right there.
Well, I would say, Scott, as I sit at home and, maybe pop the TV on, somebody who served in the United States Marine Corps, I was down at Camp Lejeune. So
Sure.
just in case you're not aware, if anybody was stationed at Camp Lejeune, there was bad water down there.
Yeah.
But if it wasn't bad water that we were drinking in the Marine Corps, it's the next commercial is about Medicare and open enrollment, and somebody famous on TV that's, wanting to talk to us about the difference of the plans. I know we recently had a client that came in the other day, and what I was surprised is I get a lot of these robocalls to my
Sure.
phone. I've added an app on my phone that actually blocks a lot of those. But, I don't need a car warranty. My student loans are all paid off.
Right.
But what I didn't realize is that older retirees are actually getting robocalled on
Absolutely.
Medicare too. So it's one of those things that buyer beware and what's happening. I mean, the decisions that you make can impact your health care coverage. So, again, I think there's probably great people out there, but be careful when you're, talking to somebody that you don't know on the phone. Be careful when you're, just looking at an ad that you see on the internet and somebody doesn't know your own personal situation. Again, it's one of those buyer bewares. The next thing I think is a big thing that's kind of a confusing topic for many people that are close to or in retirement time is understanding what is the difference between an advantage or a supplemental plan.
Sure, absolutely. So, just to hit on the phone calls, I did have a client that called me up, and, I've had her as a client for several years, and she said, Scott, I got a phone call from somebody saying they were with the particular company, Aetna, and they were telling me that if I don't make changes to my plan right now, I could jeopardize losing. And she said, that didn't make sense to me. I didn't feel comfortable with that. She calls me up, and I said, well, first of all, your plan company will not call you to re-enroll you. That's not going to happen. So if you're getting any of those phone calls, it's definitely buyer beware. Reach out to me. I can tell you whether it's legit or not, and go from there. But it's a great question, Nolan. The big differences with an Advantage plan versus a supplement. A supplemental policy is that coverage that's going to give you the coverages that Medicare doesn't cover. The supplement will. It does come with a monthly premium. It does not have dental, vision, hearing, or prescriptions, so you're going to have to purchase a drug card. It does not have a network, so that's a good thing. You can go to any doctor, any hospital, anywhere. But it does come with a monthly premium. Those premiums do have a tendency to go up every year, and then you have to purchase a drug card. An Advantage plan is a network plan. It does give you dental, vision, hearing, and prescriptions. Typically, there is zero premium for these plans and usually a zero deductible. There are out-of-pocket expenses. There's some office co-pays that you'll pay, like going to the doctor is zero, but if you have a specialist, it's like $35 copay for that. But one of the big things that is really changing, and a lot of these companies are migrating towards this into 2023, is they're offering flex cards. You can get, some of the companies out there, they have flex cards up to $500. You can use it for dental, vision, or hearing. Some plans are giving food cards. You can get a $50 a month. Yes, $50 a month for a food card that'll allow you to make purchases for food. They also have, some of them have $50 a month for utility cards. So you can actually get a monthly $50 allowance to go towards your utility bills. So those are some things that you haven't seen in the past that are really starting to come into play moving forward into 2023 with the Advantage plan. So the biggest difference is an Advantage plan typically has a network where a supplement doesn't. An Advantage plan doesn't have a premium that's going to go up each year. A supplemental does. You get some of these bells and whistles, and these are the commercials you're seeing on TV all the time. I call them the three Joes. Joe Montana, Joe Theismann, Joe Namath, and then Jimmy Walker, Mr. Dynamite. I will caution any of you out there listening and watching that if you want to talk to any of those, Jimmy Walker or any of the Joes, that 800 number will not get you to those people.
Probably not.
They're not going to answer the phone. So that's one of the biggest differences in the supplement and Advantage plans.
Yeah, I can. One other question. Then we're talking about what Medicare changes are coming, and the trend it seems like is the switch between maybe a supplemental to an Advantage plan based upon what some of the positives are and what some of the negatives that are out there. But the follow-up question about that is, if somebody switches. Can you switch back and forth between an Advantage and a supplemental plan?
Well, it's a great question. It's just like in one of our prior segments here talking about Coca-Cola. They made the switch to the new formula. I remember that. I was a big Coke drinker and still am, as a matter of fact. But kind of like that. So if you have never had a supplemental plan and you purchased, an Advantage plan, you purchased a supplement when you were first eligible, okay? Then you decide, hey, I want to try this Advantage. I kind of like the zero premium. I kind of like these low co-pays. I'm healthy. This might work for me. You make the switch, right? You actually have a chance to do it over. So from January 1st to March 31st, that is the open enrollment period, and that's kind of where you get the opportunity to make a change to a different Advantage plan. But let's say that we get down the road in, say, August or September of that following year, and you decide that change from a supplement to an Advantage was not the right change for you. It's kind of like a free test drive. You can go back to the supplemental policy that you were on with no questions asked, no medical underwriting. That's in that first 12-month period following signing up for the Advantage plan. Now, let's say that you decide 2 years later to go back to a supplement, then you are subject to medical underwriting, and you could be denied if your health status changes in a negative way. So that's a great question. Thank you for that question, Nolan. It's a great question, and I come across a lot. A lot of times I ask them, why would you want to go back to a plan that's going to charge you a premium when you can go on this plan that has the zero premium with all the bells and whistles? So, those are questions I answer every single day. And, if anybody has any more questions or anything else that we haven't talked about, just reach out, and I'm happy to help you.
And unlike those commercials on TV with the Joes and Jimmy Walker, when you do call and you set up a time to speak with Scott Kirshner, you are going to speak with Scott Kirshner, and he is going to walk you through the process and figure out what's going to be best for you going forward in 2023 and beyond that. So here's the number to the office, 419-794-3030, or you can go online to americasmedicareassociates.com and schedule a time to speak with him there as well.